The golden retriever didn't move from the newborn side for 4 hours. They thought he was being sweet. They were wrong about what he was watching for. The sound of a newborn breathing is something parents learn in the first days home. The rhythm, the pauses, the catches that make your heart stop until the next breath starts. Callum learned it the first night. His wife Sienna had been tracking it for 6 days. They both knew what normal sounded like, which is why neither of them had noticed the change. But Maple was a 6-year-old golden retriever, 67 pounds, the amber coat, patient face variety that people called teddy bear without irony. She had been the couple's first baby, present for the move, the renovation, the engagement, the wedding. When they brought Jonah home from the hospital at 4 days old, wrapped in a yellow receiving blanket and placed on the nursing pillow in the living room, while Sienna settled onto the couch, Maple had approached once, sniffed Jonah's head for 2 full seconds, and then lay down on the floor a foot away and stayed there. This was what she had done on day 1. On day 6, it was something different. Day 6, Jonah was asleep on the flat surface of the activity mat, not the nursing pillow, not the bassinet, because Sienna had set him there briefly while she sorted laundry, and then been intercepted by a phone call, and then sat down on the couch for what she thought would be 5 minutes. He was on his back, yellow blanket loose around his lower half, hat slightly askew, breathing evenly. Maple was lying on the floor beside the mat within arm's length of the child, not touching him, not watching the room, watching Jonah, specifically his chest. Callum came in from the kitchen and said the thing any father says when he sees a large dog in close proximity to a sleeping newborn. Let him come away from there, Maple. She lifted her eyes to him. She did not move. He said it again. She turned her face back to Jonah. Callum crossed the room, put his hand on her collar, and felt the specific resistance of an animal that has decided not to comply. He got his hand under her body to encourage her up, and she pressed her weight downward. Not aggressive, no sound, no stiffening of posture. She just became heavier. He looked at what she was looking at. Jonah was breathing. His chest was rising and falling in the rhythm Callum had memorized. But the yellow blanket had shifted. The loose bottom edge had worked upward across the lower half of Jonah's torso during the 32 minutes since Sienna had set him down. It was not over his face. It was not immediately dangerous. But it was heading toward a position that in another 20 minutes of normal infant movement would have been a different situation. If you stay for stories about what animals sense before we do, you're in the right place. Subscribe so you don't miss the next one. Callum removed the blanket. He transferred Jonah to the bassinet. He stood in the living room for a moment before he called Sienna in from the bedroom. He didn't know exactly how to frame what had happened. He wasn't sure it was a story yet. It was a thing that hadn't happened, because of a dog who had stayed in one place for reasons that had seemed from the outside like simple attachment. The pediatric nurse at their 6-week appointment, Rosalind Chen, 17 years in newborn and infant care, listened to them describe it and was quiet for a moment. Then she said, "What you're describing is consistent with documented cases of dogs remaining in close proximity to infants during respiratory changes. We don't know with certainty whether dogs track newborn breathing rhythm by sound, heat signature, or chemical output, probably some combination. What we do know is that behavioral intervention by a dog in exactly the way you're describing, remaining close, refusing to disengage, has preceded infant respiratory incidents in multiple documented cases." She paused. He wasn't being sweet. He was on duty. Has your dog ever done something you couldn't explain until someone gave you the scientific language for it? Tell us in the comments. These stories belong here. Jonah is 4 months old now. Maple sleeps at the foot of the bassinet. Not because Callum and Sienna asked her to. She claimed that position on day 1 and has held it every night since. Some nights, Sienna wakes at 3 a.m. and lies in the dark listening to Jonah breathe. On those nights, she also hears Maple, the slow exhale, the creak of the floor as she shifts and goes back to sleep faster than she did the night before. Every guardian deserves to be recognized, even the ones who never asked for anything in return. If stories like this matter to you, subscribe so you never miss the next one. The yellow blanket is on the shelf now. Not used anymore, not necessary anymore. Jonah has a sleep sack. Some lessons come cheaply. The next story involves a dog who did the same thing Maple did for a different reason, and the number on the glucometer at 2:17 a.m. that explained everything. Sienna put the yellow blanket on the shelf the same week they moved Jonah into the bassinet with a proper sleep sack. She has not thrown it away. She is not entirely sure why. It is not a sentimental object. It is not associated with anything she wants to remember warmly. She thinks perhaps she keeps it because it is the physical record of a thing that almost happened and didn't, and that record seems important in the same way that Sam's photograph of the ceiling seems important to him. A reminder that close is not the same as fine. Maple is asleep at the foot of the bassinet. She is on duty. She has always been on duty. They just didn't know it had a name.